purpose of a prostate is to help in the reproduction. And what it does, it sits underneath the urinary bladder. So, and when the sperm is produced by the testicles, it comes up and it goes through, and it will pass through that prostate gland. And that prostate gland will produce a chemical which coats the sperm, so that when that sperm reaches the vagina, it's going to get killed if it doesn't have a coating, because the vagina is very acid. So really the main purpose of that prostate is to protect that sperm so that it can be fertilized. It doesn't kill that at the contact of the female vagina. But since it lays underneath the urinary bladder, you develop a lot of urinary problems, difficulty starting the stream, frequency, getting up at time, a lot of times at night, pain, just a whole bunch of things, erection issues, impotency issues, just goes on and on. You can have a benign issue, which means it's not malignant, or you can have a cancer issue. But my goal is to treat them when they're in the benign issue. It's called BPH, benign prostatic hypertrophy, meaning that the organ is beginning to enlarge. And as it does, when the urine goes through this organ, it's swollen, and it so begins to squeeze off the urethra, and that's beginning to affect urinary output. So at this point, the larger it gets, the more symptoms the patient has. If you look at medicine, most of the medications that they're doing is they're trying to relieve the symptoms of that. But the reason it's there is it's because it's swollen, and it's swollen. So infection in a particular tissue for a long period of time sets you up to have a potential cancer issue. So if I was to smoke cigarettes, the smoke going in and out of my lungs is going to keep irritating the tissue and creating a swelling. And so where am I most likely going to get cancer? Lung cancer. If I chew tobacco and I put that up here and I keep this in my lip, that infection is in the gum. So the infection is there all the time, day and night. Where am I most likely to get cancer? In the gum and the throat. If I smoke a pipe and I put that pipe in the same place all the time, that heat keeps irritating that same tissue all the time, and it creates a swelling and lots of different changes in the tissue itself. So, is the smoke causing the cancer? I don't think that's the major issue in these types of things. I think it's the heat and the continued irritation to tissue that causes a swelling. So if I was to smoke that pipe, where am I going to get lip cancer? Not over the whole mouth. It's going to be right where that pipe keeps irritating those cells. So when I see the prostate and it's getting swollen and more swollen and more swollen and beginning to cause this patient a lot of issues, I know that that's got to be a precursor to prostate cancer. And prostate cancer is the most common cancer in men. And the problem is, by the time it hits the prostate, then it metastasizes to the liver, to the lungs, it goes to other places. So if we were going to prevent cancer in a chiropractic physician's office, it seems sensible to me that if I could reduce the inflammation and swelling to that prostate, that I could probably not only improve the symptoms of that patient, but reduce the risk of prostate cancer. That's what I think my purpose is here, is not necessarily to improve impotency issues or improve urinary issues, even though that's what happens, but the underlying goal would be to reduce the inflammation and swelling to reduce the risk of cancer. That's a big, and that's huge. And it's at this point, nobody out there is doing that on the basis of just doing that. They're using medications to try to reduce it. They're using surgeries to try to do that. They're using ultrasounds to try to do that. They're using lasers to do that. But in our practice, we deal with dietary issues. We deal with neurological issues. We deal with, as far as nutritional products is concerned, there is so much you can do nutritional-wise. But diet-wise, for example, one of the things that really aggravates the prostate issue is coffee. So if we altered some of those things that the patient was doing, but we will do an exam by examining the patient all over, and then I will also do a blood workup on that patient, and I'll do the blood chemistries, and I'll do a PSA, which stands for prostatic specific antigen, which basically in a prostate cancer will start to elevate. That's about the only real test that we have. We used to use acid phosphatase and alkaline phosphatase, but they weren't real accurate. This is not real accurate as either, but it's all we got. So instead of looking at the number, it should run between 0 and 4, what we look for is changes. So if you're running along and your number is like 1.9, and you're staying on an average of 1.9, and you do that, say, on a yearly basis, now all of a sudden you test it and it's a 3. You have to be real suspicious of either a malignancy or something else that's drastically changed. So with that test, it's not the number, it's the changes in the number that begins to create the interest, because at this point that's what it's beginning to tell us. I do prostate massages. I was taught that in chiropractic college all these years ago. I don't know anybody else that's doing that. Urologists used to do that on some kind of a basis. Medical physicians, they check prostates for, I'm a pilot, for your airplane physicals and that type of thing. But to treat it medically is not done as a mechanical physical medicine. It's done as a chemical medicine. So if the urologists aren't doing a prostate massage, the medical physicians, the osteopathic physicians, and if chiropractic physicians aren't doing it, who's doing it? Nobody. And so I've just picked up on that years and years ago, that it works so well. It does. It works very fast, and it works very consistent. That if I change the lifestyle of the patient and I do prostate massages on that patient, it's amazing how quickly that begins to come down. The size of that will get smaller and smaller, and usually the patient will start noticing improvement within 1, 2, or 3 visits.